I'm Neko's lead architect, Franquibel Lima. Here's how we built our largest health center in Spitalfields, London. As we build new locations, we're continuously improving not just the medical devices that come with it, but also the space. We wanted to make this different to our first location in London. The space is much bigger, with more scan rooms and an improved flow, without compromising on the customer experience. With this location, we'll be able to scan 30,000 people a year. One of the most important things when thinking about preventative healthcare is to create habits. So to do that, we need to make sure that the environments that we're creating feel positive, open, and welcoming. The first thing that we have to do is find a great location. After we opened our first clinic in Marylebone, it became clear that we had to get closer to more people. In Spitalfields, we found a building just north of the market. If you look at the map, Spitalfields is close to a massive transportation hub in Liverpool Street Station, so we could bring Neko to a lot more people more easily. When we first saw this building, we were really excited about the level of visibility that it had. Its red exoskeleton was pretty expressive. The goal was to make people feel intrigued and curious about what's beyond this wall. We call it the monolith. It's a reference to 2001 Space Odyssey, because we had this aspiration of it being something that is seamless and that feels like it's from the future. We spent quite a bit of time in workshops, prototyping things, looking at different densities of material, looking at how the light would come through it. And at the end, we landed on something that we could then reproduce across hundreds of panels. So by layering this 3D printed element with light, that allowed us to create this effect of something that feels ethereal in some way. This building has a really tall, double height entrance space. The space was so vast that we were really concerned that it wouldn't feel welcoming. So what we tried to do is use the structure of the building to build in different levels of transparency. When you look at a plan of the building, you'll see that it's very clearly compartmentalized into a lobby space, a transition area, a scan room area, and our back of house area towards the end. The lobby is completely transparent with glass, and we have this transition zone where people can go up to the scanning room that is completely opaque. All walls are clad in fabric, so there's a lot more acoustic absorption. There's a feeling of more quietness, of a sense that you're preparing to go and learn more about your health. And then in our most private areas, we have different degrees of transparency with more neutral tones, like our translucent glass and the choice of carpet that we've made with a sort of beige tone, and some white paneling, particularly on our corridor spaces. Our scan rooms are flooded with yellow. They're high-tech, but they're designed to make our members feel at ease. So the yellow that we chose is quite a fresh, vibrant yellow that actually gives you a sense of calmness, and it's somewhere between a pastel and unusual yellow color. As someone is getting into the changing room and moves on to the skin scanner and goes back to the cardio bed, then someone else can start going in on the other side. This way, we're able to maximize the amount of space available to do as many scans as possible in an hour. The debrief room is a big part of the journey that our members have with us. We felt that it was really important to distance ourselves from the memory that we all have of the doctor's office with a stethoscope on top of the table. So we built this debrief room where the focus is on the dashboard with the health information and on the members. The debrief room is packed with technology as well that allows us to make your next visit at Neko more informed. We felt it would be really important to curate the journey out of our center as much as we did for the journey into our center. So as people walk out of the debrief room and before they go out to the world, there's enough space, there's enough time for them to process the information that they just got. So there's no rush on anyone going out of a Neko clinic.